There are a few situations where cervical self-screening should not be used. This includes: if you're currently having a period, please wait until your current period has finished before taking the sample. If you're pregnant or have given birth in the last 3 months. If you're experiencing any unusual vaginal bleeding or pelvic pain, or have recently had surgery relating to that part of your body. You will also need to wait to take your sample if you've used any vaginal ovules, creams, washes, vaginal contraceptives or condoms in the last 3 days. You will also need to wait if you've had sexual intercourse, ultrasound scans or any gynecological examinations in the last 2 days. If you have any questions, please speak to your GP or nurse. If none of those situations apply to you, you're good to go. Ready? You will be taking your own sample at your GP practice. After you arrive at the GP practice, your healthcare professional will take you to a private and comfortable space where you can take the sample. When you get given your self-screening kit, please check that the kit contains all of the items you will need to complete the test. This includes a vaginal swab. This is inside the longer tube that has a red cap. A collection tube. This is the shorter, empty tube with a white cap. If any of the items are missing or damaged, please speak to the GP practice or your healthcare professional and they will help you. Make sure your hands are clean and dry before taking the sample. Read through the instruction leaflet provided in the kit bag. It should answer any questions you might have, but if not, please discuss this with your healthcare professional. The swab will take a sample from inside your vagina. It doesn't need to touch your cervix to get a good sample. You don't need to worry about whether you will take a good quality sample. Research shows that 99 out of 100 women are able to do self-screening properly. Once you're ready to start, take the swab and collection tube out of the plastic bag. Please keep the plastic bag as you'll need it later. Open the packet containing your swab and the collection tube. Take the cap off the collection tube, which is the shorter tube, and leave it to one side. Remove your underwear and get into a comfortable position ready to insert the swab into your vagina. This could be standing with one foot on a chair or sitting on the edge of a bed or a chair with your knees apart. When you're ready, twist the red cap off the longer tube and remove the swab from the plastic tube. Hold the swab at the red mark in the middle of the stick. Take care not to touch the tip that will be used to collect the sample and don't put the swab down. If this does happen, don't worry, just let your healthcare professional know and they will give you a new kit. Now you just need to use your free hand to fold back the skin that covers the opening of your vagina. Gently insert the swab into your vagina, making sure you go as far as the red mark on the stick. You do not need to reach further than this. Rotate the swab gently for 10 to 30 seconds. Nearly done. Slowly remove the swab and place it tip first into the collection tube. Holding the tube securely, snap the swab in the middle of the stick using the red line as a guide. Screw the lid back onto the collection tube and ensure it is closed securely. The end of the swab, the longer tube, and the packaging that it came in can now be thrown away. Now put your sample into the plastic bag and hand the kit bag back to your healthcare professional. That's it. Your cervical screening made easier.